Hi, my name is Madison Caesar, and today we'll be talking about the extent and the impact of mental illness. Please be advised, the subject we talk about today may not be suitable for all viewers. Before we get too deep into it, let's define mental illness. It is the condition that negatively affects and alters a person's state of mind or well-being, usually targeting the person's moods, thinkings, or feelings. Mental illness itself is pretty new to the mainstream, the front of society, as well as maintaining mental health. We're going to talk about the impact of it, the effects, and how people can cope and treat mental illnesses that they may have. A few mental illnesses we'll be getting in today are anxiety and depression. Anxiety has multiple varieties. It's usually centered around an uncontrollable fear or worry. Depression usually is centered within loneliness and melancholy. A sign of depression is a person being stuck in melancholy for 3 times in 5 weeks. However, the times may vary. The 3 times may all equal up to 8 hours apiece. Also, schizophrenia, ADHD, ASD, which is the autism spectrum disorder, which begins in childhood, which is impaired social interactions and learning interactions. A telltale sign of autism in an early child is gazing of the eye, no eye contact, being stuck in the head, difficulty accepting social cues and understanding feelings. Another impact of mental disorder is PTSD, that is post-traumatic stress disorder, which is caused by stress and trauma. It's happened whenever the body and the mind did not or cannot turn off the fight or flight. Another mental illness as well is ADHD, which is attention hyperfunction disorder symptoms, including loss of focus, forgetfulness, restlessness, usually given to kids as a label when they're too interactive or too hyperactive. Usually cope with medicine, horse therapy, some outlet, usually sports as well. Disorders like this impact the individual and their families completely different. There are treatments available to combat these mental illnesses, such as talk therapy, living skills therapy, medication, dialect behavioral therapy, applied behavior analysis, exercise, interpersonal therapy. It's important that we get to talk and discuss the impact of these disorders, and if they're not treated, the results can be catastrophic for everyone involved. Free resources are offered online as well as talk therapy. There's even a phone number for suicide prevention. It's 800-273-8255. It is important for us to talk about these disorders and illnesses so we know how to combat them, make them get better. Now, for my